Well, good afternoon, everyone. Thank you so much for joining us at this new time of 12 noon. And I greatly appreciate your flexibility as we had to bounce this meeting around a little bit to accommodate other scheduling needs. And thank you all for your flexibility. I guess there's one thing we're all good at by now, and that's pivoting. So very pleased to have you with us. Thank you especially to our elected officials and our media for making the quick change to join us at 12 noon today. So here we are, and lovely day out there. So let's take a moment to share our thanks and appreciation. So to start us off, we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, so to start us off, I would like to invite our Board of Health Chair, Mayor Andy Mitchell from Selwyn Township, to begin with some opening remarks. Please go ahead, Andy.
Thank you, Brittany. Tomorrow, we reach a long-awaited milestone in the battle against COVID-19. We will be entering into Step 3 of the Ontario Reopening Plan. Life, in some respects, will return to a greater sense of normalcy. But it is important to remember that the job is not finished. It will be essential that we continue to use common sense precautions, consider the degree of risk associated with particular activities, and be aware of and act according to the restrictions that continue in place. Although we have made good progress, both across the province and here locally in the Peterborough region, there's still a lot to do. It is important to remember that COVID-19 continues to circulate in the Peterborough area, that more than 20% of adults have not been vaccinated, and almost 44% of adults are not yet fully protected through 2 doses. You have only to see the daily case count and the fact that we've had new outbreaks to appreciate that the risk is still with us. Getting more people vaccinated will be the key to moving beyond Stage 3 to a more opened Ontario. The province will remain in Step 3 of the roadmap for at least 21 days and until 80% of the eligible population aged 12 and over has received 1 dose of COVID-19 vaccine, and 75% have received their 2nd dose, with no public health unit having less than 70% of their eligible population aged 12 and over fully vaccinated. Other key public health and healthcare indicators must also continue to remain stable. Upon meeting these thresholds, the vast majority of public health and workplace safety measures, including capacity limits for indoor and outdoor settings and limits for social gatherings, will be lifted. Only a small number of measures will remain in place, including the requirement for passive screening, such as posting a sign, and businesses requiring a safety plan. So the path forward is clear. If you haven't been vaccinated, get one now. You're not only protecting yourself, you're protecting your family, friends, and community. If you've had a 1st dose, get the 2nd dose as soon as you're eligible. 2 doses are necessary to provide protection against COVID, especially variants of concern. Once you've had your 2nd dose, remember, it takes 2 weeks for the vaccine to become fully effective. And please, encourage family and friends to be vaccinated. Doing it right means doing it together. Our community has done well in the battle against COVID-19. Let's finish the job. Let's get a jab and then a 2nd. Stay safe, be well, and in all things, be kind. Thank you.
Many thanks, Andy. Thank you very much for that. All right, let's have a look at the numbers for our local COVID situation. And Dr. Salvatierra is here to walk us through these slides. Please go ahead, Dr. Salvatierra.
Thank you. And again, I just want to echo my thanks for everyone's flexibility to change this twice. So thank you for being with us today. So I'll begin with our weekly situational report. As of last night, our active case count stands at 19 cases in the community. And this is certainly a welcome reduction from last week's 29 cases. But as you'll see in a moment, our weekly incidence rate still remains high. We've also welcomed the decrease in high-risk close contacts that we're following. We're down at 20 to 26, but we are seeing both the highly transmissible Alpha and Delta variants circulating in our community. Next slide, please. Here we show you the weekly counts. You'll see that the last 2 weeks we were going in the wrong direction. But so far this week, our cases reported is low. However, we saw as many as 8 cases on Sunday. So we know that our situation does and can change in a heartbeat. Next slide, please. We have 2 active COVID-19 outbreaks in our community that we are aware of at this time. One is the same outdoor workplace that we noted last week, and the new outbreak is in a congregate living setting. Peterborough Public Health staff continues to support infection prevention and control measures there. All the residents have been offered testing, and the staff identified as high-risk contacts are self-isolating. Next slide, please. So here with the map of Ontario, starting on the right side, you can see that our weekly case incidence rate for the period that ended July 10th is 16.9 cases per 100,000. And although it is a little lower than last week, it still is twice as high as the current provincial weekly case incidence rate of 8.2. When we compare Peterborough to the rest of the province, we currently have the 4th highest rate, our highest weekly incidence rate. And when you look at the map, you can see that this map is of active cases, the number of active cases, and you can see that Peterborough is sort of the 3rd lightest range of pink. But you can also see that we have a higher incidence rate than former hotspots like Toronto or Peel that have now fallen below us. Next slide, I'll show you our wastewater surveillance data. Now this slide's busy because it's everything from January, but if you concentrate here on the right-hand side, the latest data, the red data is from Peterborough, the city, and the blue is from our surveillance in Millbrook. And you can see that this is encouraging surveillance. Both of the sites are low. I believe in Millbrook, they are not detecting any COVID-19 in the wastewater, and you can see that the city levels remain low. So that is very encouraging to us. Next slide. We'll move on to vaccination. So here we like to see the numbers climb, and they continue to do that. You'll see in the middle that over 101,000 local Peterborough residents have received their first dose. That's 1,500 more than last Thursday. And it works out to be about 78% of our local adults aged 18 years and over. We have about 63.7% of our youth aged 12 to 17 that have now received their first dose. Where we're seeing the biggest jump is in the second doses. So as of yesterday, close to 71,000 have been administered, almost 15,000 more since last week. In terms of percentages, over 56% of adults aged 18 and over are now fully immunized, and 13.2% of youth aged 12 to 17 are fully immunized. And I know although the rate or the pace of second doses, let me start all over again. Although the numbers and the percentages of fully immunized youth are still have room to grow, I think it's really encouraging to see how quickly that the pace of that growth. Just in the last week, we had a 9% increase in the amount of youth who are now fully immunized. We'll go to the next slide, and while we are showing that only that 54% of the eligible local population are fully immunized, I think it's important to look at the data there on the left of the slide, just to show you that when we look at the whole population, it works out to actually a little less than half. 47.8% of our total population, when you account for children, is fully immunized. So that means that we still have lots of susceptible children and adults in our community who can continue to fuel clusters and outbreaks. And especially as we enter step 3. As we open up additional settings, especially indoor settings, and gathering limits increase, it also does make the work of public health a little more challenging, and so contact tracing becomes more complex. So I do urge you, if you haven't already downloaded your COVID Alert app, please do so, and please activate it. This would be a good time to do that. In the bar graph here, we're showing the percentage of different age cohorts that have been immunized. So you'll see dose 1 in purple and 2 doses in green. And we are paying very close attention to the vaccination rates in those 2 youngest groups. And we certainly believe that increasing the coverage in those 2 groups, the under 29s, will help to keep both our schools open and safe in September, but also decrease transmission in the community, as those under 20s up until now have been where we've seen most of the cases in our community. So I'll just add that as we head into step 3 tomorrow, along with the rest of the province, I do remain concerned that our higher case incidence rates locally, combined with the increased access to settings, especially indoor settings, can put us at risk for increased transmission, especially since we have both variants circulating here. Following the public health measures as we enter into step 3 will be critical for Peterborough. So to provide us with an overview of what step 3 will mean for us here, I'd like to invite Julie Ingram, our Manager of Environmental Services, to highlight some of those key regulations. So over to you, please, Julie.
Great. Thank you very much, and good afternoon, everybody. It's great to be back again. Like so many of our business partners and community members, we're excited to be entering step 3 tomorrow. And personally, I'm feeling cautiously hopeful that this will be the last reopening that we may need to go through together. But to be successful, we are going to have to work together. And this time around, it's all about collaboration. Individuals need to make sure that they're following the rules and complying with the regulatory requirements that businesses are required to put in place. This means that all individuals are going to be expected to follow physical distancing requirements, wearing a mask or a face covering when you're in an indoor setting, and staying home if you're not feeling well. If you have even a runny nose still, don't go out. That's one of the ways that when symptomatic people are in our community, that transmission can happen. Also, if you haven't had the opportunity to do so, please consider getting vaccinated. As Mayor Mitchell mentioned, the vaccination rates are going to be a large indicator of when we can move on from step 3, depending on what that looks like, to be determined. For individuals, it's going to be strange for a little while. We're going to see larger gatherings. More people are going to be permitted to be in stores and businesses. We're going to see indoor dining, weddings with dancing. We're going to see buffets resume. We haven't had those in a long time. These are all things that are permitted to occur in step 3 with restrictions. So I'm asking the public to help businesses meet their requirements by being diligent and following those rules, and definitely physical distance when you're in public settings. Some businesses have had a lot of work to do over the last several days to get ready for step 3. There's all sorts of requirements for capacity calculating and making sure that you've got your capacity posted, visible to the public when they enter, making sure that you've got passive screening signage posted. There's many sectors that will still need to actively screen their customers and patrons. So putting measures in place for that, updating COVID-19 safety plans. There has been no shortage of work for our local businesses. So kudos to you all. I know that it has been tough, but I also want to take the opportunity to remind you that this reopening was intended to be cautious and gradual. If you're not quite ready, then give yourselves another few days before you open up. And if you are ready, that's fantastic. Peterborough Public Health is here to continue to support you. We're working behind the scenes still to review all of the regulatory requirements and analyze them to make sure that we have a good understanding of what the regulations require so that we can inform you. Lots of communication has already been sent out, and there's lots more to follow. So keep your eyes peeled for that. Our website will be updated on Friday with all the information that you need to know. And you can always call us, or you can call the Ontario Stop the Spread business line. Ultimately, though, it is your responsibility as a person responsible for a business or organization to protect your workers according to labor laws, as well as to be aware of what your regulatory requirements are. So take a look at the regulations, reach out to us here at Public Health so that we can help you. And if we all work together, the step 3 transition is sure to be a memorable moment for all of us. So thank you.
Thank you, Julie. Thanks for that. And I hope you can stay around and answer some questions if our media friends have any. So I'll just conclude by highlighting a few other changes taking effect tomorrow in our long-term care homes. The province is removing the requirement for repeated surveillance testing for those asymptomatic caregivers, visitors, and staff who are fully immunized. Unvaccinated or partially vaccinated people will still need to be tested to ensure a greater level of protection for residents and staff. Other restrictions to be eased in long-term care homes as part of step 3 include removing the limits on the number of visitors to homes, permitting buffet and family-style dining again, providing all residents with the ability to go on absences, resuming off-site excursions for residents, and resuming activities such as singing and dancing. I do want to end with a few more comments on immunization. We have lots of vaccine coming to Peterborough, and we have a great many appointments still available at our immunization clinics. Currently, there are 14,000 open appointments available for anyone wanting to book their first or second dose before the end of July. In fact, we are appealing to all Peterborough residents who have appointments booked in August or later to please go online or call the vaccine booking number at 1-833-943-8989. 3900 to book an earlier appointment this month. We will be sending an email to these folks out today to advise them, and we do look forward to seeing them as soon as possible. In addition, we're running a pop-up clinic today in Apsley from 2 o'clock till 7:30 p.m. at the North Kawartha Community Center. Walk-ins for first doses are welcome. We've also planned another dedicated series of youth clinics for those aged 12 to 17 at the Evinrude Center for July 23rd and 24th. To make it even easier to get vaccinated, for walk-ins for first doses only are also now encouraged at the Evinrude Center evenings from 5 to 7 p.m. And youth can walk in at the PRHC clinic for a first dose anytime between 8 in the morning, if they're awake that early, to 1 p.m. Please know that anyone going to PRHC for vaccination does not have to pay for parking. I strongly encourage local residents to accelerate their second dose appointments and get vaccinated as soon as possible. Please remember that there may be a pharmacy near you that can provide you with easy access to either Moderna or Pfizer vaccine. I understand, for example, that pharmacies in Havelock or at the Superstore here in the city have lots of vaccine availability right now. We are starting to plan our transition away from mass immunization clinics to more targeted modes of vaccine delivery for our phase 3 of our vaccine rollout. And this could start to happen as soon as the middle of August. So please take advantage of our clinics if you can. I'll end there, Brittany, and pass it back over to you.
Thank you very much, Dr. Salvatierra and Julie, for those very helpful comments. So let's hear from our elected officials, and we're fortunate today to have Warden Jones and also Mayor Therrien, I see, is on the line. So let's start with Warden Jones. If you have some comments to share with the community, please go right ahead.
Well, thank you very much. And again, thank you for all the work that's going on at the health unit. I can't imagine the amount of detail that you're dealing with. But everything is fine and well in Peterborough County. Very proud of our staff and indeed our entire population for adhering to the rules. And we're looking forward to getting back to whatever normal is going to be as soon as we can. But, you know, I think we have to walk before we can start flying. As Chair Mitchell said, let's just take it easy. I don't think there's an expectation for everyone to be back at their desk at Monday morning. So let's just take our time and do it properly. And let's just keep obeying those rules. You know, there are so many people to thank through this whole thing for the last couple of years. And Peterborough County is starting to do just that. Tomorrow, we're going to go to Fairhaven and give a little gift of appreciation to the staff at Fairhaven. They have certainly gone above and beyond the call of duty. We know the stress that they've had to endure. There are about 350 staff at Fairhaven. That's kind of a huge number. I didn't think it was even that big. But Peterborough County is a partner in the ownership of Fairhaven. And tomorrow, we'll be doing this outside, of course. We're going to be there with a little thank you gift, and they'll get to hear my boring speech probably, but it's all done for the right reason, and that's to say thank you to a group of very special people. And there's a lot of groups of very special people out there that we want to say thank you to. So everybody, keep up the good work. And one more time, we're all in this together. Get the point and get your second point as well. Thanks a lot.
Thank you so much, Warden Jones, and how lovely you'll be at Fairhaven tomorrow. Indeed, they've been complete heroes through this. Mayor Therrien, did you have any comments you wanted to share today, or shall we just have you available for questions?
Hi, Brittany. Sure, just highlight a few things and certainly reiterate the comments that were made by Warden Jones. We thank the staff at Fairhaven and at Public Health and everybody else that's been helping us get through this. The city's moving, as we know, into stage 3, and so we are preparing several city facilities for reopening, including the museum and archives and the library. So stay tuned for more details on that, because that's, again, we're going to walk before we run. So there's still going to be a couple weeks of planning and preparation to make sure that we can reopen those facilities as safely as possible for all the staff and clients. And then again, just, continuing to abide by the public health practices that we've come to know and love over the last year. The weather's nice outside, so we take advantage of that. But again, wearing masks, if you can't remain distanced, all the messages that Dr. Salvatierra and the team have been telling us, we're getting there. Get vaccinated if you haven't. It's quick and easy, and the staff and volunteers have been amazing. So I'll leave it there for now and be available for questions. Thank you so much, Brittany.
Thank you very much, Mayor Therrien. Okay, so now we have an opportunity to hear from our reporter colleagues, and I'd also like to just point out we do have representatives from our enforcement partners, the OPP and Peterborough Police Service. Spokespeople are available, so thank you both for joining us. So let's start with Matthew Barker from the Peterborough Examiner. If you have any questions for Dr. Salvatierra or other speakers, please go ahead, Matthew.
Hi. So recently, Good Life said they're not going to be requiring their members to be vaccinated to enter the gym. Now, is this something that is going to cause concern in Peterborough?
Well, I can answer it, start, and then I'm going to ask Julie if you have anything to add, Julie. You may recall, Matthew, that indoor fitness facilities have had several outbreaks related to them, and we know that when people are exerting themselves and they are breathing more heavily, that is conducive to spreading the virus. So they are high-risk settings. It certainly would make it safer for everyone there, including their staff, if people were fully immunized. And so that is the ideal situation. I don't know, Julie, if you have anything you'd like to add.
Thank you. I think I'll just add that, yeah, ideally, we want people to get vaccinated, and that's one of the ways that all of these indoor activities can be performed safer and to prevent a fourth wave from occurring. We are working with all sorts of workplaces, including indoor sport and rec facilities, and providing guidance on how employers can support vaccination efforts amongst their workers. So that is another thing to keep in mind. And the public health measures in a situation like that, where you have those increased risk factors that Dr. Salvatierra spoke about, those public health measures become more important than ever. And that's one of the reasons that we see these measures like physical distancing and reduced capacities in certain sectors in order to prevent the spread and prevent transmission. So while not ideal, we will get there hopefully. And I know a lot of advocates for personal fitness, and I support that. But again, I put it back on the individual as well, that you need to take your own precautions to do it safely too. Thanks.
Thank you.
Okay, any other questions, Matthew? It seems like you're good for now.
Yes, I'm good now. Thank you.
Okay, great. So let's then carry on with the Examiner. I see Reg Watson is here. Did you have any follow-up questions, Reg?
If you could just reiterate what the difference is in the rate of cases locally now compared to where it was maybe a week or two ago. It seems to have been a dramatic swing both ways. Thank you.
I believe about a week ago, we were sitting just over 18 per 100,000 cases per week. And you'll see that according to our dashboard, it's come down to, and I'm wondering if, can you actually get that back up on the screen, Brittany? I don't have it in my notes. So if you put the map, that's it. So you'll see it's 16.9 as of that was to July the 10th. So it has come down just a bit, but you can see that it's still double the rate, the average rate for the province.
Okay, thank you.
Okay, thank you, Reg. Okay, let's hear from our colleagues over at Oldies and Extra Radio. So Matt Latour, if you've got some questions, please go ahead.
Yeah, my questions are for Dr. Salvatierra. I guess I'll start with the more localized question. Was there ever any risk or any fear that we wouldn't be moving into stage 3 because of the spike in cases last week? I know that we saw that with Waterloo in stage 2.
Well, it was always a possibility, especially because we were going in the wrong direction. You'll recall that our cases were increasing rather than decreasing. And with the Delta variant, we know it's even more transmissible than the Alpha variant. So things can change very quickly. I'm glad to see that, in fact, this week, most of the days we've seen small growths in the numbers of new cases. But it has still been very unpredictable, I'd say, and so we have had some days where there's been quite a large number of new cases reported to us. So what encourages me is the fact that the wastewater surveillance for the city, at least, is looking good, and that we aren't seeing an increase there. Typically, we see it there first, and then we see increases in human cases.
I know as more people get vaccinations, there's been more talk about vaccine passports and, proof of vaccination, things among that nature. Is that something you would like to see come into an effect in Ontario, or whether it not be a Canada-wide thing?
Well, everyone can have proof of vaccination. When you go and are immunized in the clinic, you're given a receipt. So you have proof that you had either 1 or 2 doses of vaccine, and you're free to share that if you're asked. I know, for example, I'm getting together with some friends this weekend, and we're all fully immunized, and we all asked ourselves to make sure that was the case. So you do have that proof. It's probably more of an issue for travelers, and that's especially for international travelers who need to show proof of immunization for entry into most jurisdictions right now. So I think I certainly know that it's being actively discussed at the federal level.
I guess my invite got lost in the mail to your party, but that's okay. And my last question, I know Barbados has said if people want to travel there and they have kind of mixed vaccines, that they would treat them as almost unvaccinated. Do you think this will, or do you fear that this will maybe prevent people from mixing vaccines, even though it's been encouraged so much here locally and in Canada?
That is a concern, I think, for travelers. If there are countries that are much more restrictive, and I know even for Canada, for example, right now, that people coming into Canada or Canadians returning have to have one of the vaccines that's been authorized by Health Canada, whereas there are very good vaccines out there that have been recommended by the World Health Organization and should be counted as well. So it is a stress for travelers but I encourage everyone that it is the right thing to do, and that hopefully these countries will update their recommendations based on the evidence.
That's it from me. Thank you.
Great. Okay, thank you very much, Matt. Okay, joining us from My Kawartha and Peterborough this week and Kawartha Lakes this week is Catherine Whitnell this week. So if you've got some questions for Dr. Salvatierra, please go ahead, Catherine.
I do not. It's one of the benefits of kind of going last. Your questions have already been asked, so thank you very much.
Okay, great. So pleased you could join us today. Okay, also joining us from from Kawartha now is Hannah Abrahams. So if you've got questions, please go ahead, Hannah.
Hi there, nothing from me today either, but thank you so much.
Okay, making it easy on us. I also see Trent Radio is joining us. Is that you, Rob? Any questions today?
Yes, it is me, but also nothing from me right now. Thank you.
Okay, great. Thank you. So I see two more. We have Danelda Fraser and Jessica Niznik. Maybe we'll start with Danelda Fraser from the Havelock Rail. Any questions today, Danelda?
The only question I have is for travelers that are wanting to go to the out of country and have had the mixed vaccines, and they're not allowed to go into those countries. Would they have to be vaccinated?
That's really a question I can't answer, Danelda. I mean, you can't have a third dose. You're only allowed two. You know, we have we need to get everyone immunized, so we're going to limit how many doses people get, and all of the evidence so far is based on 2 doses, not 3. So we're going to stick to the 2, and as you know, NACI does recommend that that mixing is an option. And hopefully the travelers will have to sort things out with the destinations that they're hoping to go to.
Okay, thank you. That's all.
Okay, thank you, Danelda. Jessica Niznik from Global News. Please go ahead if you've got some questions for our speakers today.
Thanks, Brittany. Hi, Dr. Salvatierra. Is Pfizer not now recommending a 3rd shot? I thought I heard something about Pfizer saying maybe a 3rd one and people are calling it opportunistic. Have you heard anything about that?
I mean, I've been following the media, as you have, Jessica, that right now there's absolutely no evidence to support the need for a 3rd dose. However, I would expect that the clinical trials with both Pfizer and Moderna are still in progress. They are 2-year trials. So they're still going on. Those people are being followed. We should start to hear and see and read evidence from those trials as to whether immunity does start to wane after some time. In the meantime, I've heard that Pfizer is working on a new vaccine that will be customized to the Delta variant. And so that's in development, but certainly I have not seen anything that would support the need for a booster right now.
Okay, great. That's really it for me. Unless I was going to say, do you have any final words of wisdom or message for our residents as we get ready to just open the gates tomorrow?
Well, I think we've been trying to warn people to please be cautious and make sure, be vigilant, practice all of those public health measures. And if you haven't been immunized, get immunized and move up your date. Don't wait. I know sometimes people, especially if they've made arrangements with maybe a son to drive them, or they want to stick with those dates. But we're asking everyone to please move up your appointment and get it as soon as possible. The sooner more of us are protected, the better we will be at being able to enjoy step 3 and maybe even move on beyond step 3 to whatever that new normal is going to look like.
Thanks. Actually, as you say, about step 3, there's no step 4, is there? Where step we don't know 4, where we're going?
Step 4 is the new normal, whatever that's going to be, because I anticipate that we are going to be we're going to need to continue some of these public health measures for some time. And we're, especially with the variants, I mean, the modeling that's being done now by the science table is showing that you need herd immunity above 90%. So 90% of your population needs to be immunized in order to control the variants. And so we'll continue to see outbreaks happening, transmission happening. And so because of that, we are going to need to keep some of these measures going into the fall and into the winter.
Great. That's it for me. Thank you, Dr. Salvatierra.
You're welcome.
Thank you very much, Jessica. And just to pick up on some comments that Mayor Mitchell said earlier, there are vaccination targets that Ontario needs to reach in order to exit step 3. So it requires that 80% of the eligible population has at least one dose, and that 75% of everyone 12 and over has both doses, with no health unit less than 70% fully vaccinated. So I think it's important to remember there are still vaccination targets we need to reach to further relax measures. So
thanks, Brittany, for that.
Great, thanks. So so that brings us to an end, and I would like to also just pick up on something we mentioned at the last media briefing last Thursday, that Dr. Salvatierra had offered to provide more information on myocarditis and the vaccine. So she has produced an educational video, which is currently posted on our YouTube channel, and it provides anyone with concerns or questions about the effects of the vaccine and possible effects of myocarditis. You can find it on our YouTube channel. So with that, we will come to a close. Thank you again for your flexibility today. We are slated to meet at our regular time, 12 noon next Thursday, July 22nd. So hope to see you back here, and we will have the video of this session posted as soon as possible by the end of the day. Okay, everyone, take care and stay safe. Bye-bye.
Thanks
everyone.